Hello, I'm Maura Carley, founder and president of Healthcare Navigation, and today I want to address international health insurance or international medical coverage. And, we've done a number of topics on the importance of travel coverage, and this is different. I'm talking about people who want to buy a policy that will cover them because they want to live outside the United States or they have multiple homes. So I'm not talking about people who are employed by large corporations or the federal government, and they work for the government in a position where they're abroad, or people who marry someone from another country and become permanent residents of another country and eligible for coverage in that country. I'm talking about individuals who choose to travel extensively or live outside the US and don't have the benefits like I described with these other categories of people. And it comes up more and more often because people want to live in cheaper parts of the world or they love certain areas of the world. But what's important to emphasize is that international medical coverage has not caught up with our global world. So we would encourage caution if you're thinking along those lines. And there are some very reputable carriers. Cigna's in this space, GeoBlue is in this space. But as with so many other issues that affect the topic of healthcare coverage, people often don't understand that these can be products that are medically underwritten, that can have lifetime maximums, that can have premiums that escalate rapidly, and that can have very few options when a dispute occurs. Because at least if you buy coverage in the United States, you have some protections. Not always a complaint to the insurance department, but it's usually not just solely the insurer that you're appealing to. And I'll just share a client situation that underscores the hazards, because he was traveling extensively and had coverage, international coverage through a United States-based company. And he had surgery and coverage was denied based on a pre-existing condition. Now, in the United States, a pre-existing condition is generally not something that's not been symptomatic and undiagnosed. But that's what this company used when, laboratory tests showed a certain result to deny these claims. And there was no effective way to challenge it. So I realize we're bucking the trend here and that it's not the news people want to hear. But in spite of all the issues with coverage in the United States and all the fragmentation and all the disappointments, preserving your right to have coverage that's United States based is very much a positive in our view. So thanks for listening, and I hope to see you soon. Thank you. Bye-bye.